What is bladder outlet obstruction? BOO. Imagine trying to drain a sink and finding the water just won't go down. That's similar to what happens in bladder outlet obstruction, or BOO, where something blocks the flow of urine from the bladder out through the urethra. This blockage can be partial or complete, making it hard or even impossible to empty the bladder normally. It's a condition that can cause a range of urinary problems and needs careful evaluation. BOO can happen for many reasons. In men, the most common cause is an enlarged prostate gland, known as benign prostatic hyperplasia. When the prostate grows, it can press against the urethra and block urine flow. Other causes include bladder stones, tumors like bladder cancer, narrowing of the urethra called strictures, or pelvic tumors pressing on the bladder or urethra. Sometimes, congenital issues like posterior urethral valves in male infants can cause BOO from birth. In women, causes might include a prolapse of the bladder into the vagina, known as cystocele, or complications from surgeries for incontinence. Functional causes, which involve how muscles and nerves work, can also lead to BOO. For example, muscle spasms or nerve problems may interfere with normal bladder emptying. People with BOO often experience symptoms that affect their daily lives. These include difficulty starting urination, a weak or slow stream, and needing to strain to urinate. They might feel like their bladder isn't fully emptying or notice dribbling after they finish. Some also experience frequent urination, urgency, pain during urination, waking up at night to go, or even incontinence. In severe cases, urine can back up, leading to urinary retention, which might cause pain, infections, or damage to the kidneys if left untreated. To diagnose BOO, doctors usually start with a physical exam and a review of symptoms. A key test is urodynamic testing, which measures how well the bladder and urethra are working. During urodynamics, a thin tube called a catheter is inserted into the bladder to measure pressure, and the flow of urine is recorded as the patient urinates. This helps confirm if there is an obstruction and how severe it is. Other non-invasive tests include uroflowmetry, which measures how fast urine flows, and ultrasound to check how much urine remains after voiding. Imaging studies like MRI or CORT scans can help visualize the prostate, bladder wall, or any tumors causing the blockage. Understanding BOO is important because if it's not treated, it can lead to long-term problems. Chronic obstruction can cause changes to the bladder wall, making it less flexible and less able to contract properly. This can result in recurrent infections, bladder stones, and even damage to the upper urinary tract, including the kidneys. In cases where tumors or other structural issues are involved, early diagnosis can help prevent more serious complications. Treatment depends on what's causing the obstruction. For example, medications like alpha blockers or 5-alpha reductase inhibitors are often used to relax the muscles or shrink the prostate in cases of benign prostatic hyperplasia. If there's a structural problem like a stricture or tumor, surgery might be needed to remove or bypass the blockage. In urgent situations where urine is unable to flow, a catheter may be placed temporarily to drain the bladder and relieving pressure. In summary, bladder outlet obstruction is a blockage at the base of the bladder that hampers urine flow. It's most often caused by prostate enlargement in men or structural abnormalities, but can also involve nerve or muscle issues. Recognizing the symptoms early and undergoing proper testing, including urodynamics, helps guide effective treatment. Protecting bladder health means addressing BOO promptly to prevent complications and maintain normal urinary function. Always consult a healthcare professional for personalized diagnosis and care.